Tonight at 9, hospital bed capacities reaching their limit. What doctors are doing to prevent the healthcare system in Bexar County from running out of bed space. The call for help from out of state and their dire warning for all San Antonians.
And
I feel like we're being targeted.
Why the owner of this establishment says she's not closing despite several recent visits from TABC.
plus,
A VIA driver speaking out. The serious allegations he's making against his employer about how the transportation service is handling the pandemic.
Fox News at 9 starts now.
Unfortunately, that does mean we are still experiencing an exponential surge in COVID-19 cases in our community, and the attention that we need is urgent.
As COVID-19 cases rise, we've got team coverage on the dire situation at our local hospitals. Good evening. Thank you for joining us tonight. I'm Ryan Wolf.
And I'm Camilla Rambaldi. What that situation means for you in just moments. But first on Fox tonight, let's take a look now at the latest coronavirus case numbers released by the city tonight. 650 new cases reported at this hour. Our total now at 10,797 in Bexar County. There are no new deaths to report. Our local death toll stays at 109. 3,214 people in our area have made a full recovery. But the really concerning number tonight is the amount of people in the hospital, now at 881.
By middle of next week or end of next week, we should look at another doubling of the number of hospitalized patients in town. Frankly, that'll be hard for us to hold that capacity.
If the numbers continue to skyrocket, Freeman Coliseum has been converted into a 250-bed facility and can help with the overflow.
There are nearly 24 COVID-19 patients right now waiting to get a hospital bed at one of the area's largest providers. Tonight, a dire warning from doctors treating COVID-19 patients at Methodist Healthcare System. Doctors Jairo Melco, Misha Peter, and Charles Birch fear hospital bed space in the area is running out.
We're very worried. We're in a crisis.
It's all really changed over the last 4 or 5 days to where there are 20 patients coming to just our emergency room with COVID.
We're told things deteriorated in the last 4 or 5 days as COVID-19 cases spiked to record levels in Bexar County. Doctors are seeing a shortage in not only antiviral medication to care for patients, but critical antibody blood donations from people who've recovered. What is the hospital doing to ensure that it can keep up with surging cases?
We started off with 1 intensive care unit dedicated to COVID patients, people trained to take care of this, and all the safety measures in place to prevent infection. We're now up to 3 ICUs.
Hospital stress models used by the city estimate 3 weeks or so until the number of COVID-19 patients exceeds bed space available. Dr. Melco paints a much dire picture.
That's very conservative. I think it's going to be sooner than that.
Doctors say mitigation efforts must be taken to prevent the healthcare system from being inundated. They've flown in nurses from out of state to help care for the sick who start this week. They're urging patients who've recovered to donate plasma. Everyone else, they say, has a critical part to play by distancing themselves from others and wearing a face covering.
The question is not so much if you know someone with the disease. We can answer that for you. You will know someone. The question is, what can you do to make sure that the people you know are kept safe?
Now, we also heard from Governor Gov Abbott on the hospital crisis. He told us how his office plans to handle the crowding issue in this exclusive interview.
San Antonio is home of the Texas Center for Infectious Disease. We're going to make sure that that's going to be open and available in the event that it's possibly needed. But because of the action that I took to reduce non-essential surgical procedures, it should continue to free up more bed space for anybody in San Antonio who contracts COVID-19.
We also asked the governor about other ways he plans to deal with the pandemic in the coming days.
As I understand it, just within the last 6-7 minutes, our county judge and mayor said they thought you were going to have some announcement tomorrow about what might change in Texas.
You can see the governor's answer tonight at 10 on our sister station News 4.
In addition to waiting on a hospital bed, some patients are also waiting to get the medication that they need. Rudy Palacios was admitted to Methodist Hospital back on June 17th and has been there since. He says other patients like himself have had trouble getting pain medication while they recover.
It came on so fast, I couldn't breathe for about 45 minutes. I thought I was going to die.
Dr. Melko with the Methodist healthcare system told us today there is a dramatic medication shortage nationwide. And tonight we are learning more about COVID-19 every day as new information becomes available. Fox Antonio's Yami Virgen continues our team coverage tonight. She found out which underlying health conditions put you most at risk of getting the virus.
We keep hearing from health officials that those with underlying health conditions are most at risk of being infected with COVID-19. So what are the 3 top underlying conditions amongst those hospitalized here in San Antonio and in the U.S.?
Your top 3 will be diabetes, hypertension, and obesity. What has been shown everywhere as the highest risk factors for COVID deterioration.
Doctors here in San Antonio are noticing those with diabetes are rising to the top of that list. But even more concerning is that some here don't even know they're diabetic.
So, I mean, the ones we've been seeing are diabetes. You know, it's interesting, but we have a lot of patients coming in and saying that they didn't think they had diagnosed medical conditions, and then you find out that they probably did have underlying diabetes that wasn't diagnosed.
Another high-risk factor, hypertensive patients. Those are people with high blood pressure. But the most surprising spike is among young, healthy people in San Antonio.
Unfortunately, we're also seeing healthy young people come in who don't necessarily have a diagnosis that we can put a name on. And some of these patients are getting sicker.
According to the CDC nationally, their #1 underlying health factor that adults and children have alike is obesity.
So we are seeing that as your BMI goes up, you are at higher risk for getting it. And
the CDC broke it down this way. 50% of adults and 37% of children hospitalized have obesity. 55% of adults hospitalized have hypertension. And 42% of those in the hospital have metabolic disease. Surprisingly, only 15% of children and 12% of adults have asthma. Another surprising factor, 25% of those hospitalized are pregnant women.
So we have seen a handful of pregnant women so far. Some of them have been sicker. Some of them have recovered enough to be safely discharged home.
Yami Virgen, Fox News at 9.
While pregnant women infected with COVID may not be more likely to die from the virus than women who are not pregnant, they are more likely to be hospitalized, admitted to the ICU, and require more mechanical ventilation.
Melissa Vega at the live desk, where Bexar County Judge Nelson Wolf reiterating tonight those with underlying medical conditions should stay at home right now. And he also added this. Take a listen.
We've got a dangerous weekend coming up, not unlike Memorial Day. So I want to say be very, very careful. I'd be very reluctant to send any of your kids to the beaches.
Now, Judge Wolf going on to say Governor Gov Abbott will be making some more decisions and more announcements, and those could be coming as early as tomorrow. Of course, we will keep you posted. Ryan?
Thanks, Mel. We've got new information on COVID-19 cases among first responders. 56 SAPD officers have tested positive, 20 Bexar County Sheriff's deputies, and 35 San Antonio firefighters. Local fire departments are receiving more calls from people with COVID-19 symptoms. Firefighters are responding at the same time, trying to make sure as few people get exposed as humanly possible.
On a call that's deemed non-critical, only one person will make contact with the patient at a time, and then they will call in the rest of their team members as they see fit.
Once someone is transported by an ambulance, everything is thoroughly disinfected. The crew gets pulled out so they can shower and decontaminate their uniform.